Hi, friends. Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. I've recently done a video entitled Probiotics versus Enzymes because a lot of people get confused, and those are two completely different things. As I talked about previously, probiotics are a supplement to reestablish the good bacteria in your gut, which helps you with digestion, but also immunity, also just overall body function. And refer to that video if you need clarification. So today we're going to talk about enzymes. Enzymes break down food particles. Digestion starts in your mouth with the act of chewing. So you break down big food pieces into smaller food pieces. The food goes to your stomach. Part of digestion starts in your mouth with your saliva. Then the food goes to your stomach where there is hydrochloric acid, which breaks it down even more. The food moves into the first part of the small intestine where enzymes made by your pancreas work on breaking those larger food molecules down into tiny, tiny, tiny food molecules. So the nutrients can pass into the bloodstream and the blood vessels line the small intestine. So what happens if you don't have enough enzymes? And a lot of us today, for whatever reason, our pancreases are not producing the enzymes we should. So we have indigestion, which leads to all kinds of people diagnosed with all kinds of problems like IBS, colitis, gastritis, all kinds of stuff, meaning really just your body's not digesting properly. So if you find that after you eat, it feels like you have, like your stomach is full and it won't move, it's just like stuck in your belly, you may need enzymes. If you have troubles with constipation, diarrhea, back and forth, whatnot, you may need enzymes. And the best way to see if you need them is just to try them. They're easy to take. And because these supplements are breaking down foods, you want to take these supplements immediately prior to your meal. So carry them with you all the time. Because anytime you eat something beyond just like vegetables, although I'll get back to that, you're going to want to try these enzymes. I'm going to share a screen with you right now to Integrative Therapeutics, and this is Similase. Integrative Therapeutics is a professional brand. We carry it in my office, but you can also find it at your better health food stores. Similase covers all of the aspects of digestion. And what I mean by that is if you go to the ingredients, it covers protein digestion, it covers fat digestion, it covers milk and milk product digestion, and it covers vegetable digestion because some of us have difficulty breaking down the hard cell walls of vegetables. Specifically, we want to think about cabbage and also beans, which are not a vegetable, but can be difficult to break down. And there's other enzymes in there also, as you can see. I'm going to scroll through because Similase or Integrative Therapeutics has different Similase products. This one is Similase lipo meaning fat. So if you have an insufficient liver or maybe a gallbladder that's a little pooky, you're going to want to try the Similase lipo. It has more of those enzymes to digest fats. So that's butter, fatty meats, any kind of oils. And then if we go to the next one, this is a Similase for gluten, digesting gluten. If you have a sensitivity to gluten, it might be an allergy type, like a delayed allergy, or it could be just you don't digest it. So this might be a great thing to try if you're somebody that's gluten sensitive. Maybe these enzymes would help you to process gluten. The last one I'm going to show you is Similase BV, and this is specific for beans and vegetables. So if you're somebody who just gets really uncomfortable after you eat Brussels sprouts or cabbage or beans, this will really help a lot. So I always have in my purse, I always have enzymes available. There was a time back in the day when I was healing my gut where I needed to take enzymes every single meal, every single day. And I was such a mess. I did that for years. And then suddenly I realized, or I knew that I didn't need to take them all the time. So I cut down my use and found that I was pretty good. Now, these days, 2023, I rarely take them at all, ever. However, every once in a while I do. Like last night, I was out to dinner for whatever reason. I think it was the soup had a little bit too much of a milk product in it, and I had trouble digesting it. And I could tell as I was sitting there, I was just like, ugh, I feel like, oh, that soup tasted so good, but it's still sitting in my gut. Got a couple of enzymes out within minutes. I felt better because those enzymes work immediately on breaking down the food products and helping them move through your digestive tract, which is what we want. So I hope that helps. Make sure you get a good, reputable brand from a reputable source. If you have any questions, leave it in the comments below. Bye for now.